Hey everyone, it's been a little while. My name is Michael Moon. Time for another regional health update. And this time around, we are talking to Dr. Albrecht, who is a orthopedic surgeon, or doctor, should I say, the orthopedic surgeon.
The orthopedic surgeon. That's exactly right.
Yeah.
I'll say it this way. I am one of the orthopedic surgeons. There we go. That's what I'll say.
You got a great staff. So where were you from originally? What are your interests? Tell us a little bit about yourself.
Yeah, sure, absolutely. So I was born and raised in Kansas, just small town Kansas, kind of the central portion of the state, and otherwise kind of stuck around that area. So I did my undergraduate and medical school education there, and then actually stuck around in Kansas and did my residency training, and then out of training actually worked there in Kansas for about 6 years before coming out to Montrose, Colorado, and so very much Kansas born and raised. Although you bring up interest, we've had a lot of interest in that has brought us to Colorado on multiple occasions as a family, and even before that, growing up, spent a lot of time here. Whether that was in the summers doing camping type things or in the winter skiing, and so that's kind of a lot of our interest. Just anything outdoors, that we can get involved in. Again, whether that's camping and hiking and fishing and skiing, and just any excuse to get outside and enjoy nature. And that was one of our interests in this community, was there's just so much of that stuff around here, and so many of those opportunities. So that's something we were definitely interested in. But yeah, so far it's been Kansas and now Colorado. So that's my life story.
Yeah, well, my brother is, we grew up on the Front Range, and he moved to Lawrence. And he was saying that he had to get back as much as he could because he missed the mountains. He missed all this stuff.
Sure. Yeah, it's pretty, as everyone well knows, it's pretty flat there in Kansas.
Yeah.
I spent some time in Lawrence as well because I went to KU for my undergraduate education. And so, yep, I'm a big KU Jayhawk fan. And so,
all right.
Yep.
Very, very cool.
Well,
so you're an orthopedic surgeon. I know a lot of us have had to deal with orthopedic surgeons, but those who haven't, tell us a little bit about what you do.
Yeah, absolutely. So, I think, first and foremost, orthopedic surgeons deal with a very wide range of musculoskeletal conditions. I think traditionally everybody thinks of orthopedic surgeons as the bone doctors. We're always called the bone doctors, and that's true. But we deal with a lot of other things other than just the bones. I mean, everything around the bones, the joints, the muscles, ligaments, tendons, nerves, all those good things. And it also involves a wide array of different types of conditions, whether that's related to spine disorders, to sports-related injuries, which are very common around this area, all the activities around here, and then also things like arthritis and degenerative disorders, all the way to tumors and cancer. And so, we're involved in lots of different areas that affect the musculoskeletal system. And, we're involved in the evaluation, the diagnosis, the treatment, so kind of all aspects. And that can mean a lot of things. If you go see an orthopedic surgeon, we're going to sit there and talk with you about, first and foremost, what we think is going on. And then when it comes to the treatment, something that's not unique to orthopedic surgery, but definitely medicine in general, is this concept of shared decision making. And so not so much the days of just, the doctor's just going to decide this is what we're going to do, and this is what they said we're going to do, and I got to do that. It's more about the orthopedic surgeon sitting there, and we talk with our patients and say, hey, this is what you got going on. Here's all the options we have. and we're going to come together and we're going to make a decision together. And what that's proven to us is that our patients actually, number one, are happier, and number two, we're seeing better outcomes when the patients are more involved in that decision making, and that may even involve input from their family and friends. And so everyone coming together and deciding what's the best course for us to proceed with. Treatment wise, that's a big topic too. I mean, lots of orthopedic conditions are treated without surgery. We're orthopedic surgeons, but we very commonly are treating patients without requiring surgery, and that's an okay thing. And that can involve things like physical therapy and occupational therapy, rehabilitation, education on home exercise programs, and activity modification. Maybe we can change certain things we do in our life to treat certain issues, and then we move on to things like medications and injections. And
wow, there's just a lot. You're impressing me right now. I there was more to orthopedic surgery or just being an orthopedic surgeon than I would imagine. It's just
sure, absolutely. Yeah, it's not just surgery. Now, surgery is a big part of it too, and that's a big topic as well, with lots of options. And that's what we all spend so many years training to do. But again, there's a lot of focus outside of surgery, everywhere from non-operative treatments to prevention of orthopedic conditions as well.
So, what drew you to that? Were you a big sports guy, or what made you decide to kind of step into that? Because that seems so overwhelming.
Yeah, you bring up the sports topic, and that's very common. I mean, that's a common story, and I think that probably played a part for me as well. But I think if I go back, so growing up in a small community, I actually grew up on a ranch, and so my first exposure to any type of medicine was veterinary medicine, and getting to see treatments administered and watching those animals improve and heal and get back to health, I think was my first exposure. And then after that, I think I became interested in surgery just in general.
Oh, wow.
I think a lot of surgeons will tell you that, we're the group of people that like that, immediate gratification. And so there's something that's unique and fun about being able to see a problem, identify that problem, and then almost immediately correct it, with something like surgery. And so I think that's what drew me to surgery. And then, the orthopedic side of things, definitely sports. I grew up playing a lot of sports, and if you play sports, injuries are part of it. I mean, either it's yourself or friends or family. Everyone knows somebody who's had a sports-related injury, and then they were sitting in an orthopedic surgeon's office. And so, I think that was part of it. And then I somewhat jokingly say I enjoy all of the fun tools and toys that we get to use.
That's what I was going to ask you. I mean, as a surgeon, I know it's somebody's health that you're dealing with, and to say joy or enjoyment as being a surgeon, people would probably look at you going, really? That's kind of weird. But it, like you just explained, it's about making people better, making them feel better, and being part of that community is pretty important.
Yeah, absolutely. I think being able to, again, identify that problem and get to use the technology that we get to use, and know that, hey, that bone is now fixed, or that tendon or ligament's now repaired, and we have started that patient down that path of healing. There's a lot of satisfaction there, and it's such a privilege to watch our patients improve and get back to the things that they enjoy doing and are important to them in their lives.
Well, Dr. Albrecht, I think that's fantastic. You're the guy that I want with the knife. I'm going to tell you that right now. You're the guy I want.
Well, I appreciate that.
Well, and one final question, and this is just being silly. Do you ever do a mic drop? You get done, you throw the knife down, and I'm out of here. Thank you. Good night. Ever happen?
Well, somewhat jokingly, but we try to do our best to not drop things in the operating room. That usually doesn't go over well. But yeah, it is a privilege to walk out of that operating room and to get to look at everybody around you. Whether it's your assistants or your nurses and everybody there as a team has come together and performed a successful procedure, and to walk away feeling happy, and most importantly, feeling confident that patient. Well, I think that's the best part of it.
I think what I'm going to send you, I've got these little blow-up microphones that I always use for when my kids were younger, so they could sing along. Maybe I'll bring one of those over so you can do a ceremonial mic drop outside the operating room.
That's right. I like that.
Thank you so much for your time. That's a lot of great information. Join us again next time for another Regional Health Update. I am your host, Michael Moon, and just remember, information provided in this podcast is for informational and educational purposes only and is not meant to diagnose any condition or provide treatment advice. Please work with your healthcare providers to determine appropriate treatments for you. Thanks again. We'll talk to you next time around.